Well, we've talked a little bit over the last few days about this big blast of cold weather. It gets people to think about, well, it's cold and flu season. I know some people that have already come down with it, right? You probably do too. In the UK, they're warning it could be the worst in decades. Health officials in North Carolina reported 4 flu deaths already. The answer from the medical establishment, predictably, more people need to get the flu vaccine. But is that true? We talk about it. It's always a hot topic. Join me now, Peter Gillooly, the CEO of the wellness company. Peter, nice to see you.
Thanks for having me, Steve.
It's always get a vaccine, more vaccines. I have not gotten a flu vaccine in years, to be honest with you. The question is simply this: does it work?
It's a great question that everyone asks, Steve, and you can actually go to the CDC website yourself and look at the data. So what people need to understand about the flu vaccine is this. Every spring, the CDC guesses effectively on what the dominant strains of influenza are going to be in the fall. And it's a very hit or miss process. At a good year, they're maybe 60% correct. And you can see over the past 20 years of data that the CDC displays, the flu shot is at best moderately effective in identifying what strains of influenza are going to be going around in the fall. The second question that we have to ask is, okay, if they guess right, which we know isn't always the case, does it actually work? And this is where the science gets a little dark. So there have been studies that have come out and, they've been repressed, and I know Dr. McCullough and others have covered them, but there's actually many cases now where we're seeing that the flu vaccine actually has negative effectiveness. So meaning that you actually get more sick if you have a vaccine. And there's a number of different drivers of this. Most of them are physiological that rely on the patient, but it begs the question, why do we keep doing something that just doesn't show a lot of effectiveness when there's far more safer ways to stay healthy during flu season?
Sure, if the efficacy is suspect, which it is and has been. Look, this isn't something we learned during COVID. The flu vaccine was suspect to me years before we ever went through that whole ordeal. So the real question comes down to, okay, what can people really do to keep themselves healthy during cold and flu season? There are things that can be done, right?
Absolutely. And it starts at home, right? Getting sleep, good hygiene, the things that our moms used to tell us all the time when we were kids, Steve, those do help prevent influenza. Other things that you can do is use something like a nasal spray or mouthwash. Hygiene in the sinuses is extremely important. We've been talking about this for a while now at the Wellness Company. We brush our teeth every day. Why don't we clean our sinuses? We created a nasal spray that actually uses xylitol and some other very safe and non-painful ingredients that actually flush the sinuses of bacteria and viruses. And if you do that every day, that really disrupts the incubation period, because colds and flus, they start in the sinus cavities. That's where they incubate, that's where they reproduce, and then they spread to the rest of the body. And by that point, you get quite sick.
Right, and this is something I was not fully aware of this until we did go through COVID, all of us together collectively. But your nasal passages up here is a reservoir where that virus can replicate. It's like a place where it can make other virus, and it replicates and can continue your sickness longer than it should, right?
Yeah, look, it's the entrance to the body for most of these diseases, and it does turn into a petri dish, especially this time of year. So we really try to urge people to do what they can to flush out those sinuses. Look, even if it's just a simple wash with salt water, that helps. Do that periodically during flu season, and you're much less likely to get sick.
Absolutely true. And again, we'll get back to those nasal sprays in a minute, because we started using those from TWC a while back. Here I am, bright-eyed and bushy-tailed. I guess it's working for me. Now, I want to move on to another topic for a moment, because conservatives and libertarians are very disappointed with the elections in New Jersey, New York, and Virginia. Some would call it a disaster on the right. We know that during the pandemic, Democrat governors restricted access to safe and affordable off-use drugs like Ivermectin. I've told this story before. I was very sick with COVID. My doctor and I argued back and forth on the phone, got kind of heated. She called me back, said, fine, I'll place the prescription, but you got to drive an hour and a half. I said, fine. I did it. I took it mid-morning that day. By the time it was sunsetting, I was in good shape again. I was a different human being. Ivermectin changed the trajectory of my illness. Are you concerned that this new wave of ultra-liberal governors could once again limit access to these affordable, effective drugs?
Absolutely, Steve. And I know we're winding down the government shutdown, hopefully this week. But we really need to remember that the Democrats' core pillar of healthcare policy has been government control, throwing more money at the problem. And what have we have to show for it? Well, we have ballooning healthcare costs and worse health outcomes. And we saw during the pandemic that using this heavy-handed government centralized response doesn't work. And they were intentionally suppressing very safe and effective and most importantly, cheap medications like ivermectin that show a tremendous amount of efficacy for these diseases. And I think to your experience, the earlier you take them in the course of sickness, the shorter the course of the disease will be and the better you'll feel immediately. And
Yeah.
if we're just waiting for check into a hospital, which really is the liberal response to medication or to disease, go to the hospital. That's usually at the point where you're so sick that you're going to be there for a long period of time.
Yeah, we don't want that. And the second thing is the ivermectin you can get from the wellness company is American made, and I like that too. So two things: the nasal spray to combat that reservoir of virus, and ivermectin. These are things that should be on your shelf. And by the way, while I'm talking about this, you got these great emergency kits that you can pick up at the wellness company with all sorts of great medications, an instruction book on how to use everything in here. Don't get caught short, right?
Absolutely. Preparedness is the best response for sickness. I mean, we all keep, water and extra cash on hand. Why wouldn't you have medication? I think you'll use it far more often than those other preparedness items in your household, and you'll be better off for it.
Absolutely true. Peter Gillooly, always appreciate you being here, my friend. Thank you very much.
Thanks.
And right now, you can find out more at twc.health/Gruber. Look, all of these are available there, plus so much more. The Wellness Company has been my partner in good health for quite some time. These emergency kits, look, they're perfect. They put them on your shelf. You don't get caught short. You've got antibiotics, antivirals, antiparasitics, all right here, plus several other great kits. A first aid kit, a travel kit, a kit for kids. All of this can be found at twc.health/Gruber. Use the promo code Gruber. You'll save 10%, and you're going to feel good. You're going to feel good doing it. I'll take a break and be right back.